My name is Sarandha and I'm a senior clinical psychologist at Amaha Health, Delhi. Every year, 10th of October is celebrated as World Mental Health Day with the goal of raising awareness about mental health concerns and helping those who might be experiencing these concerns themselves. In line with this initiative at Amaha, we have decided to address some pertinent questions that you may have about mental health. Starting with the first week, the theme is signs of distress. First question. I need help, but it feels almost impossible to ask for it. What should I do? As a therapist, I can imagine asking for help can be a very daunting task, especially if you've had multiple negative experiences of help seeking while growing up. One question to ask yourself would be, what do I feel now as an adult when I think about asking for help? Do I feel scared that I might get punished or embarrassed or rejected? Do I feel guilty that I am expecting somebody else to take out time for me? Do I experience a sense of shame for not knowing how to help myself? Or it's something else altogether? All of these emotions would be indicative of the kind of experiences that you might have had as a child whenever you asked for help, or maybe even as a young adult. And over time, you might have learned that in order to emotionally survive or emotionally cope with difficult feelings, I need to avoid this one behavior of asking for help, because every time I ask for help, it's met with something bad. You might also see that as a child, it would have worked for you to maybe avoid this behavior because it helped you feel a little bit more regulated. But as an adult, you're possibly noticing that this strategy is no longer serving you any purpose. In fact, there are situations where you need help and not asking is actually unproductive. It would help if you can maybe talk to a therapist over time, identify the kind of unresolved feelings that stem from help seeking and cope with them in a more structured way. But something that possibly you can start on your own is choose one person who you think is trustworthy, who you know will not judge you or make you feel criticized or make you feel bad for asking for help, and ask for help for something small. It could be something that doesn't require a lot of their time and effort, and you would also feel comfortable requesting them for it. It would also help to practice what you want to say before you seek help. Um, Practicing the words that you want to use, because sometimes we feel like we're put on the spot and we don't really know what we want to say to the person. So starting with something as small as, I need help and I'm not really sure how to ask or what to ask for, but I thought you're the person who would be able to help me understand what I need, and here's where I am. You could do this with a friend, a family member, or even a therapist, depending on what kind of social support system you have. It's important that over time, if we expose ourselves to these small situations gradually where we ask for help, uh, this kind of exposure can actually help reduce the anxiety or the fear or the guilt and embarrassment that you feel around help seeking, especially if you're able to provide yourself with more positive experiences of help seeking. I think my father is an extremely anxious person, but we've never spoken about mental health things before. How can I encourage him to go to therapy? Talking to anyone about their mental health, especially your parent, can be a very delicate conversation which would require time, space, and energy, and possibly multiple small and big conversations that can eventually lead them to seek support. The first thing to do would be to initiate a conversation around anxiety at home. You can pick and choose whether you want to do this in an individual capacity with your father or with the entire family, where you talk about what anxiety is, how it might not be as fruitful to feel this in this much intensity across different situations. You can also give enough space to your parent in that conversation to understand what anxiety means to them, how they experience it, and whether they've noticed that it's gotten difficult for them over the years to cope with this emotion. It's also important that while you're having this conversation, you choose the right time to bring up the need for mental health support. So let's say that your parent is already in an episode of anxiety and they're feeling feeling pretty overwhelmed, that would not be a good moment to point out that they need help. As opposed to that, maybe choose a moment when they're feeling a little bit more regulated and calm, and highlight it as a concern that you've noticed that, I see that you get overwhelmed, and this particular emotion can be a very stressful experience for you. I have heard that therapy is one form of treatment that can help you cope better with anxiety. Do you think you would be open to that? So you see, you're coming from a place of you're coming from a place where you're not really pushing them into seeking support, you're not labeling their anxiety as a problem, but you're saying that this experience seems to be overwhelming for them and there is support to help cope with it better. It would also help to highlight that therapy is not something that one does or goes to when there is a crisis, or uh, when you're in some sort of problem, but therapy is something that one can do as a means of self-care. Like you would go to the gym, or like you would go to the doctor if there is some sort of health related concern. Similarly, for mental health related concerns, you can engage in therapy as a self-care activity. So that would also help reduce the stigma that your parent might have about seeking therapy. It's also important that you don't push them into it if they're not ready, because therapy is something that usually works when the person is slightly more motivated on their own to seek support. So give them the options, help them find therapists, maybe help them feel that they're not alone in this, and if they want you as a child to go with them for a session, you would help them with that as well. And eventually the decision needs to be left on them. Any sort of um, coercive instruction that they have to go for it because they have a problem is probably going to get their defenses up and not lead to any resolution. Lastly, you can probably lead by example, talk about your own experiences with anxiety and what you did as a young adult or an adult to support yourself. Maybe talk about your own experiences with therapy and then see where it goes. My partner has a lot of past trauma that keeps coming up in our relationship. I try to reassure him, but it's exhausting. It's like he's angry at me for things I didn't even do. Being in a relationship with somebody who experiences intense negative emotions frequently can be a challenging experience, especially if you've taken on the responsibility of trying to fix things for them. Before I talk about how you can support your relationship better, I would talk a little bit about how trauma impacts the brain. So, repetitive interpersonal trauma, be it physical, emotional, sexual, or verbal in nature, has an impact on how your brain interprets threat. Your partner might be functioning from a fight or flight mode or a survival mode without being aware of it, which possibly means that anything small or big that resembles their past traumas can trigger their brain to perceive that as dangerous, as threatening, and can lead to a reaction of anger, anxiety, or anything else that helps them protect themselves in the moment. It's important to note this so that we're able to understand that triggers and reactions to triggers are not necessarily in control when a person has experienced intense interpersonal trauma in the past. As their partner, there are a few things that you can keep in mind when you're having these kind of interactions with them. Let's say that your partner got triggered by something that you were not able to make sense of. It's very normal for the person in front of them to try and reason with them, to try and understand what just happened, and to try and have a conversation with them. But in that moment, your partner is probably not in the zone to talk. So, the first thing to do when you notice that they've gotten triggered is to help them regulate. And by regulate, I mean physically regulate. Maybe do a couple of rounds of deep breathing with them, give them a glass of water, give them a piece of chocolate that they should probably eat for the next 2 to 3 minutes. Ask them, or if you're already aware, do something that helps physically soothe them in the moment. The things that I mentioned, plus maybe giving them a couple of ice cubes to hold in their hand for a few minutes, or going for a short walk. All of these things can help physically regulate your body so that you can come back to your baseline. Once your partner is back to their baseline, it might be fruitful to have a conversation with them about what triggered them and how they made sense of it. Apart from this, it would also help to encourage your partner to seek therapy from a trauma informed professional or a trauma informed psychotherapist who can use a systematic approach to help them cope with their triggers in a better fashion. It's also important that you set some healthy boundaries for yourself while being in the relationship, which doesn't mean being rigid or judgmental about their triggers, but in the moment, if you're feeling quite overwhelmed by their reactions, it would be okay to ask for a timeout or to say that you need a couple of minutes or maybe a couple of hours to just be on your own, and you would come back and revisit that conversation. I feel drained and burned out, and it's almost impossible to stay on track at work. I am scared they'll fire me. What can I do? Let's start with acknowledging that burnout is a temporary state of the mind and body as a result of experiencing sustained stress over a long period of time. A lot of times we tend to blame ourselves for feeling burnt out by saying that we're not capable enough or we don't have the ability to handle stressful environments, which then leads us to take on more work that can be counterproductive to burnout. The first thing to do would be to acknowledge that you're experiencing this as a result of your circumstances and your environmental constraints, and then look at what are the sources of stress. What is it that you can change in your environment, be it with respect to your routine, your work life balance, the amount of work that you're taking, the amount of social responsibilities that you're handling. Look at all of these as sources of stress and see where you can bring about a few changes for a short period of time as you recover from burnout. As you also mentioned that you're worried about being fired from work, I would encourage you to speak to your supervisor, your HR, or your manager about the kind of struggles that you're experiencing and see if they can help you regulate some amount of work for a brief period of time, maybe a couple of weeks. It's also important that if you're not able to take, let's say, a longer vacation from work, you take micro breaks through the day, which would mean, let's say, a 10-minute walk every 2 to 3 hours, or taking a tea break every now and then, maybe taking a video break or a screen break every now and then. And if you're working from home, then maybe taking a 20-minute nap in the middle of the day can help you recharge a lot. In addition to this, it would also be important that you work on your communication at work and try to say no to things that are outside of your capacity at the moment. Of course, this would depend on the kind of industry that you're in and the kind of work environment that you're part of, but try to set some healthy boundaries at work where you're able to say no to things that are beyond your capacity or your capabilities at the moment. I constantly overthink everything and it's affecting my sleep and daily routine. How can I learn to quiet my mind? Overthinking that seeps into your daily life and makes your sleep, appetite, and daily routine dysfunctional can be an indicator of an underlying mental health condition like an anxiety disorder. It would help to speak to a professional like a psychologist or a psychiatrist to rule out any potential diagnosis. At an individual level, there are four things that I would suggest for you to do to curb the overthinking. One, try to challenge your thoughts. A lot of times, overthinking happens because one tends to imagine the worst possible scenarios or all the what ifs that could occur in a potential situation. When you're thinking of the worst case scenario, try to ask yourself, what is the evidence for the fact that this situation would occur? Then ask yourself, what is the counter evidence against my thoughts? Then weigh the evidence against the counter evidence and see if you're actually able to get objective evidence for your worst case scenarios. More often than not, you will have more counter evidence which can help soothe your anxiety. Another thing to ask yourself to challenge your thoughts would be, let's say I've imagined a worst case scenario. Now, what is the best case scenario in this particular situation? Come up with the most ideal positive outcome that exists. The third thing to ask would be, now that I've imagined a worst case scenario and a best case scenario, what is the most realistic thing or realistic scenario that's likely to occur? Thinking like this would help reduce the anxiety about the potential of a worst case scenario occurring and give you a more objective future to hold on to with respect to the more realistic scenario. The second technique that I would suggest is called worry time. If you're somebody who's used to worrying or overthinking the entire day, it would help to take out some time separately in the day where you can just engage with worrying. It's a conscious effort to think about everything that you've been worried about and then focus on the things that can be problem solved or can be controlled and engage with those. So, the way you use this technique is you take out maybe 20 minutes sometime towards the end of the day, not just before bedtime, not just when you've woken up, and not in the middle of your workday either. So, maybe sometime around 6 to 7 pm, assuming that you're working a morning shift. Take out 20 minutes and note down everything that you've been worrying about. Out of these things, pick and choose the things which you think can be problem solved, for which there can be an objective solution, and try to work on those. Over time, if you engage in a worry period every day, a couple of things can happen. One, you might reduce the list of worries because you're actually problem solving and looking at them more objectively within that 20-minute period. Two, you'll also learn how to delay your worries by possibly telling yourself in the morning. Let's say you've woken up and you're thinking about 5 to 6 things. You can tell yourself that I've scheduled time for this in the evening. Let me think about this then. So that way you will also learn how to compartmentalize some thoughts and possibly not let them seep into your daily routine or your schedules. Two other things that you can do to manage your overthinking would be grounding and journaling. So, grounding exercises like deep breathing, mindfulness, any sort of self soothing can help regulate your body's physiological response and can also then bring your focus to the present moment rather than staying here where all the overthinking happens. Journaling can also be used as release. Sometimes our thoughts can be so many in number, it can be so overstimulating that just getting them out on paper can help in regulating. So maybe try these four things and see how it works to reduce your overthinking. Of course, it would help to seek therapy and utilize a systemic structured approach to work through your anxious thoughts. I feel like I'm always putting others first and neglecting my own needs, but I don't know how to set boundaries without feeling guilty. How can I start? Being part of a collectivistic culture, we are often taught that choosing others before ourselves is the way to go. Along with that, one might have grown up observing people around them who are constantly giving in relationships without expecting anything in return. In fact, such an individual would be labeled as a good person, as a kind hearted person, and someone who chooses themselves over others would be labeled as selfish and a bad person. These kind of experiences often then instill guilt in us whenever we think about asking for space or setting any sort of boundary in a relationship. It's important to note that healthy relationships are based on mutual respect, which means that if there are times that you need to set a healthy boundary that are keeping in mind your and the other person's feelings, it should be fine. So, the first thing to do would be to recognize that you have the right to set healthy boundaries in a relationship. It would help to start small and to start with somebody who you can trust and will not judge you for saying no to something. You should also be open to the idea that the other person might feel a little disappointed with your no since they're probably not used to saying no, but that's completely fine. As adults, we are equipped to handle some amount of disappointment that comes in relationships, and you don't have to necessarily take the responsibility for that. It's also important that you communicate your no or you communicate your boundary in a gentle and kind manner so that the quality of the relationship and the foundation of the relationship can still be maintained. It's also important that when you set these boundaries and you experience guilt, you try to reinterpret or reframe the guilt. Ask yourself, am I feeling guilty because I'm doing something wrong? Or am I feeling guilty because I'm changing an old pattern and it's uncomfortable to do that? It's the latter probably, because there's absolutely nothing wrong in setting boundaries in healthy relationships. Every time I'm getting better, something happens that triggers my anxiety or depression again. Why can't I seem to move past it? What you're experiencing is a normal part of recovering from mental health concerns like depression and anxiety. Recovery from such illnesses is never linear, there is always going to be an up and down. It's also important to understand that every time there's a setback, you're also developing some amount of resilience or new coping tools. So it's really not a setback or a failure in the sense that you're back to square one, but it's an opportunity for you to execute some of the things that you might have learned about yourself in therapy, to implement some of the tools that you might have learned in therapy, and to be able to pull yourself out of that trigger or that situation faster than maybe the last time. One thing that you can possibly do is try to identify if there's a pattern to these triggers and then bring those up in therapy or with your mental health professional if you're seeing a psychiatrist, and see if there can be a structured plan to address a specific trigger. Usually, if there is one particular trigger which always takes you back to a zone of being depressed or anxious, then possibly there are some unresolved feelings around that situation or that trigger that need to be addressed in a more intense manner. Maybe one more thing that you can do is you can try to come up with a toolbox of coping strategies which is kept handy, so that anytime there's a trigger, you can reach out to these tools and bring yourself out faster. So these tools could include grounding strategies, some sort of physical activity, seeking support from specific people, engaging in meaningful hobbies, among others. You can also try to speak to your therapist and revisit your treatment plan and bring up this concern wherein every time there's a trigger there seems to be a slip into an episode of depression. Maybe then your therapy needs to focus more on relapse prevention and a better way to address these triggers.